So he goes on vacation and they take his liver. I have to share this story with you because if anything, I always try to find how can we learn for this? How can we prevent this from happening to you? So recently, this huge story came out. I'm sure you've seen it on the news. A 70-year-old and his wife go to Florida for vacation. He ends up having really bad abdominal pain. His stomach's really hurting him. So they end up going to the hospital, the emergency room, like, hey, what's going on? And they do some testing and they determine like, oh, this could be a malignancy. This could be cancer. We're going to have to do some more testing. You're going to need to stay a while. We got to see what this is. Well, if anyone tells you you may have cancer and you're out of town and you're in a lot of pain, you're not about to say, well, I'm going to wait till I get home and consult with my own doctors. I mean, what would you do? So he's in pain. He agrees to the further testing. So they do MRIs, they do a CT scan, and they tell him, or at least what's on the post-surgical report, that there's something very wrong with his spleen. It's enlarged. His hemoglobin's going down. So usually in the hospital, we do a blood test called a CBC. It's a complete blood count. It looks at, primarily we're going to look at, if we're worried about bleeding, hemoglobin and hematocrit. Hematocrit tells us basically how many red blood cells are there. Hemoglobin tells us the oxygen carrying capacity of the cell. But when those both numbers go down, or sometimes one will go down, we worry about a bleeding. Anemia too, but a bleeding going on. So his hemoglobin count was really going down. So something was urgent. And I think I would have done the same thing. I would have been like, yeah, we got to figure this out. Let's keep going. And he has, a surgeon that's been in practice for years and years doing the surgery. He specializes in lower GI, colorectal types of surgeries. And he's saying, yeah, looks like we're going to have to do laparoscopy, look at your spleen, may have to remove the spleen. So he goes into surgery. They remove his liver. Mm-hmm. And, you can't live without your liver. It's like pulling your heart out and being like, well, we're going to sew you up. You're going to be fine. They remove his liver. Now, when I first saw this story, I was like, because the liver is on the right side of the body. It's right under the rib cage, kind of right here. So, when you have an abdominal exam, the doctor will put their hands deep and sometimes kind of cup their fingers up under your rib cage to see if the liver's enlarged or if there's pain. So there's your liver. And then your gallbladder is tucked up right under there too. On the left side is where your spleen is. And so to me, the first thing I was thinking, how in the world do you mix up a liver and a spleen? Now, apparently in the past, people have had organs that may be rearranged in not a traditional manner, or if you had cancer with bleeding and an organ is really enlarged, I could see how it would move or it would look like it was not exactly where it was supposed to be. But that would have to be, there would have to be something really, really going on there. And so as soon as they remove his liver, he bleeds out and he does not survive the surgery. There's major arteries and veins that feed the liver and that come out of the liver because the liver is basically filtering, making cholesterol and so many things involved. So you can't live without your liver. And so the post-surgical report said, there was a splenic aneurysm, there was a rupture, there was bleeding, the spleen was so enlarged and diseased, and then they sent it off to pathology. Well, the pathologist is looking at the cells and under the microscope and like, these are not cells of the spleen, but these are liver cells. So you've sent me a liver. And so the case is ongoing right now. There's a malpractice lawsuit going on now, and they may be looking at criminal charges as well because the negligence behind the surgery is so egregious. There may be criminal charges. And, I look at the case of the nurse, I think it was a year or two ago, that gave the wrong medication. They both started with the same letter. I can't remember the medicine at this point. I'll say A. Both began with the letter A. And so, but they were very, very different names. And she gave it to the patient and the patient died. And so she was under criminal charges. They finally dropped the criminal charges, but obviously she's no longer working as a nurse. But I look at this case and I think, how can a surgeon, and this surgeon had years and years of experience, and I get it. They started with laparoscopy where you go in with the scope and you're looking around. And I guess if in his mind, I'm just trying to think how this could happen. If he's thinking, oh yeah, it was the spleen that was the problem. And oh yeah. And if you kind of convince yourself something in your mind, you're determined to see that even if there's little red flags. And so really what was going on with this patient and why he had abdominal pain, he had a cyst on his spleen that ruptured, hence the pain and hence the bleeding. But, there's treatment for that and it's pretty simple, and he would have survived that if he didn't undergo this surgery. And so what can we learn from this, and what can we do to avoid it? Well, his spouse was with him. I mean, obviously she wasn't a surgeon or a doctor or in the medical field, but I kind of look at this case too. And if the same thing was going on with me, I think I would have gone ahead and done what they said as well. I don't think I would have done anything different. I think it's just one of those tragic cases, because there have been cases before where they removed the wrong leg or the wrong limb. And now doctors actually mark on the limb. They'll put big X's where not to go and cut here or do here. They literally mark up the body now to prevent accidents such as these. Also, there's a very stringent scrub nurse and techs that are, counting off tools and counting off supplies and just making sure everything is double checked and rechecked. So I don't know what could have happened in this case. The case is ongoing. It's probably going to draw out 6 to 9 months long. So I'm sure as more information comes out, we'll talk about it. But what can you do to protect yourself? I think it's always good to have an advocate with you. And there's nothing wrong with getting a second opinion. Many hospitals have patient advocates if you don't have a family member or a friend with you, but I highly recommend you always have a friend or a family member with you, especially when you're going under things and you're in a lot of pain or you're so ill you can't speak for yourself. It really helps to have a living will. It helps to have, again, he was in a state where he didn't know these doctors, new hospital, new surgeon. None of these people knew his medical history. Now, I don't know if that would have changed the outcome, but I just think, would it have been a better outcome if he said, look, I know I'm in pain. I see what you're saying. It's urgent, but I think I could get on a plane and fly home. Again, hindsight's always 20/20, right? Who knows? But if you have an advocate saying, look, I think we should get a second opinion, or if you can't go to another facility or hospital, try to at least have another doctor kind of come in and consult on that. You don't have to be rude and mean. You can be polite. But I think this is just one of those cases where even an advocate might not have been able to stop, because this was extreme surgical malpractice. So I'm going to do a live tonight. The live's at 7 p.m. tonight. We'll talk about more cases like this and kind of your thoughts about what happened. To be continued. Thanks for seeing me on this one, and I'll see you on the next one.